Hi guys, this is me Gayatri Akil and welcome to College Online OET. So here I would like to discuss with you all about 5th of August 2023 OET exam in which OET writing. So first case note was a known case letter. So my students has given me information regarding the letter so that I am going to share with you all. So the first case note was a known case letter. So here a community nurse is writing a letter to a patient's GP. Patient was admitted in the hospital following a fall at home, and patient has undergone further diagnostic procedures and assessment, and came to know that patient had hip fracture. So the patient had left hip replacement surgery. So after the hip replacement surgery, patient received blood thinners and also patient received pain medications, and the relevant medications has been given to the patient to prevent the infection as well as the pain, to reduce the pain. And patient got discharged under the community nurse home visit. So the community nurse was doing a home visit and she was make sure that patient's wound is free from signs of infections and discharge, and also the dressing was continued for the patient, and apart from that the patient was on physiotherapy and patient started to mobilize. And later on what happened, patient was complaining to the community nurse during the home visit that the patient was suffering with the constipation for 3 days, and patient has no bowel movements, and also patient feel discomfortness. So this is the main reason a community nurse is writing this letter to the patient's GP for the further treatment and management. So this is the case number 1. So how we can write here this letter? So as usual we are writing the date on the top of the letter, and then we are writing the addressing person and address, and also we are writing the salutations, and then we are writing the patient name and the date of birth. Now we are coming to the introduction point. So in the introduction, so most of them were having a confusion. Should I write hip replacement, left hip replacement surgery name, or should I write the current complaint of the constipation? So here I can say at the moment patient is getting a good recovery from his surgery part. But the problem is patient is suffering with a constipation. That is the main reason for the community nurse to write a letter to a patient's GP, isn't it? So here the main complaint is a constipation. So that can be written in our introduction. Even though if you are writing the hip replacement surgery, it's not a harm. But still the main problem why we are writing the letter to the patient's GP means it's because of the constipation. So how we can make the introduction for an example? So here we are writing there to make an introduction, as we know the 3 things. One is patient name, another one is patient diagnosis, and also we are writing to the writing a purpose. So why we are writing this letter to that particular person. Okay. So as a known case, it is not necessary for us to mention about the social background of the patient, so that can be completely eliminated. And here introduction, present medical history paragraph. So what was happened to patient at hospital, and after the discharge, how the patient was getting recovery at home with the help of a community nurse, and along with it what is the current problem of the patient. This all has to be narrated in the present medical history paragraph, that can be splitted as 2 passages, as we are not writing the social background of the patient. And then recommendation, what the GP has to do for the patient in a requesting way, and then conclusion and salutation and winding up the letter, isn't it? So now here the introduction, and we are writing the patient name, and we are writing the current problem of the patient. So we can write patient suffers with. So here write Mr. EX. For example, you can call the patient name as EX, because my students has given the name of the patient. I think the patient name is like Sidin Mirza. Sidin Mirza, and 76 years old. So Sidin Mirza, 76 years old. So we are just writing this letter to the Sidin Mirza's GP, like that we can have. So Miss Sidin's Mrs. or Miss, what the title they have given in your in the question paper, you can use the title, and we are writing the patient name, who suffers with the constipation following a hip replacement surgery, following a left hip replacement surgery, full stop. She requires your, what kind of assessment? She requires your assessment and treatment. She requires your further assessment and treatment, like that also we can write it. And then coming to the point of, we are writing to the present medical history paragraph. So Miss like Mrs. Azra or Miss Azra. If she is a married woman, you can use Mrs. because as what title they have given in your question paper, that same thing you can write it. So Azra and got admitted on so and so date with a so and so complaint, which means following a fall, and therefore she has undergone a successful hip replacement surgery. Post-operatively, she received adequate treatment and management, and and she got discharged on so on date with a community nurse home visit. She has been under community nurse home visit on this day onwards. You can write it during the home visit. The patient wound was dressed, and patient's complaints with the physiotherapy, and also there is no signs of infection on the wound site. So all things has been written. So recently, which means maybe the today's visit, the patient might explain to the nurse that I am suffers with a constipation. So that today list, you can make it as a separate paragraph to show to the reader that this is the reason I am writing this letter to you, like that. So that the today's history you are writing today, Mrs. Misra has complained of 3 days history of constipation, along with discomfortness and no bowel movements. So what happened? So she needs kind of like what kind of the treatment. Either it could be a laxatives, or she might need an ultrasound. So we don't know what could be the treatment option is given by a patient's GP. So we are coming in the recommendation paragraph. So it would be appreciated if you could do further assessment and treatment for Ms. Asra to overcome her constipation, like that. You can, your concern on her condition is immensely appreciated. Then you are writing, please contact me for further discussion, further clarifications, further doubts, and then you can write yours sincerely. If the name of the addressing person given in the address, please try to complete the letter always with yours sincerely. If no, you can complete the letter with yours faithfully. So this is the way you have to write this known case letter. So Sidin Misra, so letter. Okay, it's a known case letter. Main problem is constipation, but the patient got admitted for the hip replacement surgery following a fall at home. Okay. So now coming to the second letter. So what was the second letter? It also was it was also a known case letter. Here we are writing a letter. Here hospital nurse are writing a letter to the psychiatric manager, because where the patient was admitted and got the treatment for his depression, and now the psychiatric treatment was the one, manager was the one referred the patient to emergency department due to patient was suffering with the symptoms of deep vein thrombosis. Okay, so we are writing this letter once we finish the treatment of the patient. After 6 hours of observation, patient got relief from the problem, and patient was put on the medications, blood thinners and leg elevations and physiotherapy. Patient got discharged after the 6 hours observation, and patient is going back to the same psychiatric manager department because patient is on treatment for his depression. Okay, so now this letter of information is like patient was admitted in the emergency department from the psychiatric unit. So why the patient got admitted, which means patient because of the pain and the swelling, and also patient unable to walk. So they have diagnosed the patient with a DVT with the help of diagnostic procedures, for example Doppler and ultrasound and CT and MRI. And after that they have started the blood thinners and analgesics for the patient, and also patient has given hydration therapy, and also patient started with physiotherapy, and also patient was taken for the blood investigations, and they have put on the blood thinners for the patient. So these are all the things has done to the patient, and education also given to the patient how the way they have to look after themselves. And the patient was kept on 6 hours observation in emergency departments. So once the observation has forward, they are writing a letter to the same psychiatric manager regarding the follow-up management. So what follow-up the management, which means they have to continue the medications of especially the blood thinners. At the same time they have to go to the GP appointment to taper the, which means to reduce the dosage of the blood thinners based on the investigations. And second thing is educate the patient to elevate the legs all the time, enhance the blood circulation of the patient, and make sure the patient is compliant with the physiotherapies. So these are the main recommendations has been given to the patient caretaker, which means the psychiatric manager, because the patient is going back to the same unit where he was receiving treatment for his depression. So here, as usual, no need to write about the patient's social background. because where the patient was living, where the patient was taking the treatment, that same place the patient is going back. So it is not necessary for them to know about again the repetition information of his social background. So here we are writing date first, and then address is second, and then receiving person address is second, and then patient name and date of birth and salutations and everything. Then coming to the point of introduction, and I'm not quite sure about the patient name as per my students, because they didn't given me the name of the patient. So here we can just start with, for example, X. So with the X is suffering with what? So the X is like who is recovering from. So you get it, who is recovering from deep vein thrombosis. So he needs what he needs. He needs to be monitored for he needs to be monitored for medication and medication compliance and medication and physiotherapy compliance, like that you can write. Purpose and present medical history paragraph, they must know from the date of admission to until date of the discharge what all the treatment has been given to the patient and how the patient is reacted to the treatment. That has to be elaborated as much as possible and make it as a two passage, because as we are skipping the social background here, the present medical history paragraph should be elaborated. So patient got admitted, as you are aware, patient got admitted because they were the one referred the patient to the emergency department, so they know which day they have referred. So as you are aware, patient got admitted in emergency department on this day with the symptoms of pain, discomfortness and numbness and all those things. Therefore he or she, I don't know about the gender also, so that you can write he or she, whomever it is, like has undergone certain procedures, so like Doppler, and the patient has undergone your ultrasound of the leg and then MRI, this all those things, and which is confirmed the above mentioned condition, which is deep vein thrombosis. Therefore patient was put on blood thinners and educated about the importance of leg elevation and initiated physiotherapy programs. And then patient was kept on 6 hours observation. So during the observation, patient showed improvement in his condition, the pain reduced, and also patient was able to walk. So these are the signs and symptoms patient showed as a positive way. So the patient is being discharged from the emergency department and going back to the psychiatric management unit. So here now, recommendation paragraph, that they have to what they have to do, they have to continue, make sure that patient is taking the medication on proper time and he is compliant with the medications, and he has to go to his own GP to review his medications and to taper the dosage of the blood thinners, and then educate the patient to educate the patient importance of keeping the leg elevations and continue the physiotherapy program. So these all things has to be written in the recommendation paragraph. Then conclusion, and we are closing the letter. If they have given the name in the address, so we have to conclude with the yours sincerely. If not name given, we have to conclude the letter with the yours faithfully. So these two letters are a known case letter. So one benefit of getting a known case letter is it is not necessary to worry about the social background of the letter. So only you are focusing on your introduction, present medical history and a recommendation paragraph. So this is more than enough. So we have to think and write, and we have to select the information which is necessary for the reader and what they can do for our patient to help them to get recovered. So I hope this video will helpful for all the students who is preparing for their upcoming exam and how to prepare for the known case letter. And we are taking online classes for the students and who is preparing for their OET exams, and also we have the beginners classes of 40 days, and then also we have the classes 50 days classes, and also 30 days, 20 days, 10 days classes, and also we are running mock batch also. So we have individual modules also, like writing is there and speaking is there, if you want to take writing and speaking together. So that also is going on. So whomever interested, join in our class. Our number has given in our description. You can contact us at any time. So until then, bye bye.